This is Jenna Smith, and this is the Journal 4 podcast reflection. The first thing that I'm going to talk about is the first section of the evaluation reflection, which is to evaluate my emotional children's growth and development based on the action plan in my self-assessment. And the first thing that we're going to talk about specifically to that is the personal characteristics of my emotional intelligence. How did the clinical experience and QI project promote growth and development and personal characteristics, self-awareness, self-control, and motivation? So one area identified in my self-evaluation that was an area where growth was needed was in my confidence. This was established in my clinical experience by getting feedback from my preceptor. She was great at giving me feedback, and I was always interested in seeing how I was doing. And I kind of talked to her about my self-evaluation from the emotional intelligence paper, and kind of told her that that was something that I wanted to get feedback from her throughout the semester that I was with her. Another way in which I achieved this growth in self-confidence was through working with the student nurses. One thing that helped me in working with them, the underclassmen, was one thing. Part of my self-confidence is that I sometimes just don't feel like I know as much as I feel like I should. But there was a couple times they'd ask me questions, and I was like, "Oh, I know that," you know. So that was really neat to be able to kind of kind of a mentor and be somebody that somebody can go to, and be that kind of knowledgeable person, and kind of made me feel a little bit better about myself. So that's how I grew in self-confidence, and it's according to personal characteristics, and those are just examples throughout the semester how I did grow and those experiences and how they helped me grow. Then we're also going to look at my emotional intelligence, the social skill of empathy. And in this part, I'm going to describe a situation that challenged my empathy skills. What did I learn about my degree of empathy? So what I put for this one was, when looking at my empathy, I didn't feel like this was necessarily a challenge, but narrative empathy that was practiced was service orientation, which is anticipating, recognizing in me the needs of others. This was done in meetings with my preceptor when we had sit-downs with the lead nurses and discuss the neighborhood model. In this meeting, we were able to identify the concerns that the nurses had with the model and things that were maybe a struggle and a stressor for the nurses, and areas that we could work on that. We allowed everyone to give their voice in this model, and we would identify areas that were a concern, so we can try to make changes the best that we could and find things that we could actually help make this system work better for the lead nurses. So this was kind of a way of practicing empathy by this service orientation. We kind of anticipated that the nurses weren't happy with this. We recognized that there were issues going on with this model, and we wanted to get feedback from them so we can meet the needs of others. So we wanted to meet the needs of the nurses to make this work for them. So that was kind of like a way I grew in my empathy skills, or kind of challenged my empathy skills. All right, so next we're going to talk about social skills of conflict management. I'm going to give an example encountered during clinical. How effective was this management style? Was the conflict resolved? Was your conflict management strategy ideal? While other strategies might have been more effective? What have you learned about your conflict management skills and related to teamwork and collaboration? So my answer to this question is one kind of conflict that was encountered in clinical was, again, in regards, kind of like previously talked about, in regards to the neighborhood model. There seems to be definitely issues with that in the hospital. This was not a conflict that I was directly involved with. I just kind of was there, but I was able to identify and see how conflict management strategies are incorporated and how they work. But when looking at this neighborhood model, there was a conflict with the neighborhood model. Also with that neighborhood model was staffing. The strategies utilized for this conflict was collaboration to identify areas that were a problem area, see what improvements need to be made, and although the conflict was not completely resolved, we kind of worked together to kind of maybe come up with ways that we can do, that we can actually implement to make it better. So, for example, a huge thing in this collaborating that we were able to get feedback from the nurses was, there's a lot of transparency. They feel like they don't know what's going on and why their people are getting floated because they're not telling them why their nurses are getting floated. There's no transparency. It's like they always feel like the staffing's keeping secrets from them. So that was something that Lori had said that, maybe she can take that to staffing and discuss this with them, to be more transparent. And that's something that we need to work on to make this more effective. A couple other things that were identified that could help with the situation was fixing registry, and having registry balance out their schedule. So we kind of identified by using the collaborating technique to manage this conflict with the neighborhood model. We were able to come up with some ways that we could better it and kind of like make it better for the nurses. So next we're going to move on. How did I manage social skills of time management? What time management skills were required of me this semester? Describe strategies I've practiced to manage school, work, family, and other demands on your time. How will you apply learning in this area in the future? When looking at this time management skills that I had to implement this semester, is just basically planning and organizing and staying ahead of things was a big thing that I had to make sure that I did. There was no falling back. So I had to put all class schedules, clinical times, homework, assignments, work schedule, all this stuff had to go into a planner. So that way I could make sure that I was where I needed to be, when I needed to be, that this was due and that was due, so that I could make sure, like I could look at the beginning of the week and say, okay, what do I need to accomplish this week? How am I going to do that? I would say, okay, well today I'm going to do this, tomorrow I'm going to do that, I'm going to get this done. And then also had my time scheduled with my preceptor as well. I mean, she worked with me really well. If I needed more hours, she was always willing to add more in there. So that was always nice. Again, that required planning on my part because I was like, okay, what do I need? What do I need to get done? So so kind of like I would plan things according to priority. Clinical times and assignments were always my priority. I made my schedule at work to only be on the weekends. That helped me out a lot this semester, that I only worked on the weekends. If my assignment in clinical was a light week, I would be able to pick up an extra shift at work or something like that. But like I said, it was always kind of like planning ahead. So what can I contribute this week depending on my school schedule? Can I pick up an extra shift at work? Those types of things. When looking at my family always kind of takes back burner, so but any extra time I spent with my family and husband. It takes a lot of planning to manage time. I'll definitely apply this to my future as a nurse, to make sure when I walk into a shift that I make sure that my tasks are planned throughout the day according to priority or acuity, and making sure that so that way I can stay on top of things and get things done at the end of the shift that I am responsible for taking care of. So that's how I will incorporate that into my time management skills into my future practice as a nurse. Next, we are going to talk about personal growth related to QSEN, pre-licensure knowledge, skills, and attitudes. How have you demonstrated competencies in at least 3 of the 6 areas? So when looking at this, answering this question, my growth in quality, safety, education of nursing. 3 areas that I have gained knowledge, skills, and attitudes in are teamwork and collaboration, quality improvement, and evidence-based practice. When looking at teamwork and collaboration, I was able to see how working together as a team in different areas of the hospital that need improvement. We can identify different needs, areas that need improvement throughout the hospital, so that way we can fix the issue. If an issue is identified, what do we need to do? Do we need to implement education for nurses? Do we need to add extra education and orientation? Is this happening in new nurses? We're kind of identifying what the source of the problem is, why this problem is happening. Like an example is like the fall rates for the whole hospital, and some of the meetings were talked about, and reasons why those falls were happening. So extra education could be done on the units to kind of make sure that we're doing our best practice. That's kind of how collaborating kind of contributes to that. If an issue, let's see, sorry, I'm getting lost. Also, I was able to implement a quality improvement project, and how this was beneficial to quality and safety. I was able to see how the information provided helped increase student nurses' knowledge on the topic, making them feel more comfortable. This was identified because I did a pre and post survey for my QI project, so you could see how I asked several questions pertaining to how they felt comfortable on specific areas when it came to IV therapy. I asked them if they felt comfortable with the basics of IV therapy, and then got to kind of see how they felt after the QI project, and kind of see where the scores were at, and they definitely increased. So I kind of got to see how quality improvement definitely helps enhance quality and safety education for nurses. This was identified, sorry, I'm getting lost again. I also gained competency on evidence-based practice. I've learned that making sure you implement these practices is important to patient safety. The fall risk, for example, the fall risk prevention team tracks falls in the hospital, kind of like I talked about a little bit earlier. One of the reasons the falls were occurring were bed alarms were not being set according to evidence-based practice. We need to set up our bed alarms. We don't just make that up for no reason, that it's shown that bed alarms help prevent the risk for falls. But why aren't we implementing this, and why is a bed alarm the reason why we're having these falls? So you can see how just evidence-based practice is really important to quality and safety. How has the QI project impacted my perception on degree of influencing a nursing student can have on quality improvement with existing nursing staff? So my QI project impacted my perception on the influence that I can have on nursing. And I had a positive perception of it. I didn't think that being a student you could be influential. With identifying a need, I learned that you are able to provide information that is evidence-based to help enhance practice. So, and education is a great way to do that. So that definitely boosted my perception on the influence I can have as a nursing student. So next. How did my preceptor contribute to my learning experience? I was able to learn about what it is like to be in a leadership position. My preceptor is a director of nursing for acute care at Randalia. Her role encompasses many things. She is a busy lady. So she oversees the units and their performance. She looks at what is going on, what's going well, and what areas need improvement. For example, Randalia had an increase in falls. She notifies the units about the problem so they're aware of the problem. And the managers on the unit can implement teaching or provide awareness to the staff. She also goes to a lot of meetings. My preceptor contributed to my learning experience by showing me what a leadership position does. There are many meetings involved with being in a leadership role where they learn about diversion that goes on in the hospital, falls, and much more. Not only that, she is there for her staff to make sure they are meeting their goals and assist them. One situation she did really well as a manager was another manager on a unit asked her to come to the unit, and there was a little bit problem with the staff member. The staff wasn't happy on the floor, and she was thinking about quitting. So Lori came down and came down and talked to this nurse. And she was the lead nurse. She was stressed out. She was kind of overwhelmed with having to take on such responsibilities. It seemed like they were always short-staffed, and being a lead nurse, like, you know, she had her own patients too. She was always staffed, and she had orientees on, and she wanted to help them learn, and she just was, felt like she wasn't taking care of herself, and so she was able to kind of like talk to Lori about things that need worked on, and Lori was really great. She handled the situation really well. She was a great listener. She showed that she cared. So she let them express their feelings. She handled the situation very professionally and told the staff member that, you know, if this isn't something that she, you know, this isn't a position or a place working here is something that she wants right now, that's totally understandable, and that she just needs to take care of herself and needs to do what's best for her, because, you know, you don't want, she didn't want her staff members to be really stressed out and kind of taking a toll on them as a person and their home life and all that stuff. So she was really good about that. She supported the staff members' decision and provided support. This is kind of a way in which she coached. So most of my experience with Lori was going to meetings. A lot of my experience with Lori was going to meetings, but throughout clinical, some tasks were delegated to me. She delegated a task of taking notes for her in a meeting that she was running, and also when we were with the students on the floor, I had a task of making sure students were completing assessments and passing medications. But I didn't necessarily delegate to other staff, I felt like. I couldn't really think of any way in which I delegated to anybody during this, but I was delegated to. Next, how did I meet 3 of the course outcomes according to AKA job profile? I met outcome and objective number 2. This assesses prior learning, a target audience, and priorities for quality improvement project. This was done by providing a pre-survey to students asking questions on various areas of IV therapy. So that was very specific for the target audience. I met an additional outcome and objective number 3 by evaluating the effectiveness of conflict management strategies utilized by the preceptor. I was able to evaluate the conflict management strategies of collaboration. So like I talked about, one of the management strategies that Lori had used was collaboration. This method seemed to be an effective way, so I got to see how the nurses kind of felt relief that they finally got to kind of be heard by the people in leadership. So that you can see that may help them kind of feel a little bit better. Using this collaboration strategy to resolve the conflict allowed members to express concerns or feelings related to the issue. So areas that can be worked on can be identified, then implemented. It seems like also kind of like a nice collaboration is kind of like a nice way to kind of incorporate everybody in the problem solving strategy as well. And then the third outcome was met Objective 7 by validating growth and development over the semester in emotional intelligence. I did this by talking about my self-assessment paper with my preceptor, just like I had mentioned earlier. So by doing this, I was able to evaluate how I was doing and maybe look like, oh, okay, so what do I need to do differently? I was kind of able to learn what causes my lack of self-confidence, which is, I guess, the fact that there's so much to know in nursing, and I just feel like I don't know it all sometimes, and it makes me nervous when I get asked questions and stuff, but I was able to answer questions right, so that definitely helped me a lot, because I'm like, I've spent the last 4 years in school, do I know all this? And, I can't, and it's nice to get asked questions, because I'm like, holy cow, I don't know how I still know that, but I do. So that's a really great way. That's basically my biggest area that kind of causes me not to have a lot of self-confidence. And then also one thing that contributes to my growth is my confidence. Part of the clinical experience that contributes was growing a relationship with my preceptor. As we got to know each other, we were able to talk about my growth. I was able to get feedback from her. Her feedback gave me confidence as a nurse. Another clinical experience. Sorry, I'm getting lost. Grab at least to me. Okay, so I'm talking about, I apologize, I'm getting kind of all, I have my paper here and I'm trying to make sure I talk about everything. So describe at least 2 meaningful clinical experiences. So one of them was being able to grow in my self-confidence, and part of that was by working with my preceptor and getting feedback with her. She is a great role model, and so I value what she has to say, and it means a lot to me. So that definitely helped me a lot growing my self-confidence, was kind of growing that rapport with her, and getting that feedback, and that good feedback definitely helped with that. Another clinical experience that contributed to my confidence as nursing was working with the students. It was really neat to work with them in a leadership kind of role. I liked being able to answer questions about different things, and like I kind of keep talking about, it was a really good experience for me to kind of get that where I'm the person that people are asking information about, and I don't know everything, but I actually do know quite a bit. So it's always kind of good to be tested, and I like that about working with the students, was they definitely tested my knowledge, and it was a good experience. All right, I believe that is it. I think I covered everything. All right.